willing to accept questions from members of the public at any time, or you're welcome to attend our board meetings in public. The dates of those are all on the website. And if you want to contact me direct, we have a lovely email address, which is awp.askthechair, all one word, at nhs.net. I'd be delighted to have any questions through that email address, which will come direct to me and the corporate team. So that's where we are for this morning. Just need to ask board members, we have circulated in advance the minutes of the meeting held on the 14th of September last year. Can I just have a wave of hands to say that you approve those, please? Thank you all very much. They will be noted and approved. And I just have to formally ask the board to receive the annual report and accounts. If you've had the electronic version of this agenda, you would have had a link to the annual report. If you want to see the annual report, if you can just flick to the next slide, please, Jess. That is the link which you can find there on our main website, awp.nhs.uk. So I think that's all I have to do in terms of introduction. No one sent me any desperate WhatsApp messages, so I assume I haven't erred yet. And I have great pleasure to look over the strategic overview. I will pass on to our Chief Executive, Dominic. Welcome. Good morning.
Thank you, Brian, and thank you everybody who's taken the time to attend today. We know that you don't have to, so the fact that you're showing interest and want to engage with what we're doing is genuinely appreciated. Also, sort of kind of contingent apologies in advance. I'm in an unfamiliar location this morning, and the Wi-Fi has been a little intermittent. So perhaps if I could ask Brian or Donna, if I cut out and I'm not aware, just let me know by waving violently and saying we can't hear you. If we could move on to the first slide, please, or next slide. Here is it enshrined in a page, if you like, the things that are important to us and the things that we're doing. Everything we do is we try to make sure is in accordance with our values that we call our Pride values, which are very well known and talked about by staff. Pride stands for passion, respect, integrity, diversity, and excellence. Passion is about kind of passion for improvement and excellence and inclusion, and trying to make everything we do as good as it possibly can be. Respect is about respect for individuals and the experiences that they may have had, whether they are colleagues or patients or family, friends and carers. Integrity is about what it says, which is having the integrity to do the right thing rather than an easy thing. Diversity recognises that we serve a hugely diverse population in every possible respect, and we also employ a hugely diverse group of people in every respect. In addition to which, of course, no mental health practitioner would wish to progress with mental health service design and delivery without co-producing that with people with lived experience. So everything we do is a joint endeavour, and we need to make sure that we reflect and understand back to the diversity of the many different people that we serve and work with. And finally, excellence, which is about striving for excellent outcomes, which is perhaps trickier in mental health than in other health sectors because they're more difficult to define, although there has recently been some really great work nationally to come up with a set of outcome measures that we're in the process of implementing. So those are kind of the values that we bring to the table in everything we do. Our vision is about delivering high quality, compassionate care for people living with mental ill health, learning disabilities and autism. We strive to be the very best we can be, and recognising that many of the folk that we serve come from quite disadvantaged backgrounds and have had to overcome significant difficulties in their lifetimes for a myriad of reasons. We are passionate advocates for improving the lot of people who suffer from those illnesses or lifelong conditions. And I won't say we're the only people who do that, but we're kind of, as a statutory body responsible for the delivery of services in the populations that we serve, we are the main institution that does that. So we have that crucial advocacy role as well. The way we try to do that is through our aims, which are four: being a great place to work, partly because that's a good thing in and of itself. Why wouldn't you want to work in a great place to work? But also the evidence that if you provide a great place to work, you then also provide great care is overwhelming if you look at international evidence. So looking after colleagues is hugely important to care delivery. That leads to the second one, which is, of course, providing outstanding care. And the rule of thumb that I always use is, if it was my loved one, would we be providing the sort of care that my loved one could reasonably expect to provide and that I would want for them? Delivering sustainable services, which is about making sure both that we have financial constructs that work, but also all the other constructs around delivery of services. So, contracts, staffing, service models, that sort of thing, to make sure that they're not just fit for today, but they're fit for the future as well. And where they're not, understanding and identifying that and putting in place plans to address that. And working together in partnership. Nothing we do in mental health is done on our own. We work with primary care, we work with the police, we work with ambulance services, acute trusts, social care, voluntary and community sector. I could go on schools, the private sector. So everything we do is not just a multidisciplinary team, but a multi-agency team, and making sure both that we're a kind of trusted partner, so somebody that people can rely on to walk the walk as well as talk the talk, but also, given our advocacy role, that we also challenge back and say, hang on a minute, is this right? Are we doing the right thing here, or could we be doing something better? A key part of working in partnership. All of this is described in our strategy, which is a document that has been widely co-produced with, I think, nearly 1,000 stakeholders now. And we refresh that every year based on feedback, and we'll be doing so again through the autumn and the spring, and make sure that it reflects the different stakeholders that we have. And we have formal mechanisms for doing that. So if you're interested in what we're doing and how we're doing it, or you don't think we're doing it well, or you think we are doing it well, either is, I would say fine, but you know what I mean, it's fine to say either. Then we really, really would love to have a conversation with you. And that kind of enshrined on a page is what AWP is about. If we could move to the next slide, please. Some of the initiatives that I would like to highlight around the Great Place to Work. So we're placed 10th in the UK's top 50 most inclusive employers list. We're by no means complacent about that. We know from our key documents, for example, the Workforce Race Equality Standard or the Disability Equality Standard, that there's lots more to do. But it's also worth saying that there's lots we have been doing, and some of that is beginning to make a real difference to people. But that endeavour continues and will continue for many years to make us a truly inclusive employer. Last year, we recruited 104 internationally educated nurses, which is just phenomenal and is more than double the amount that we recruited in 22-23. And having spoken with many of those, I don't think I've spoken with all by any stretch, but I have spoken with many of them. They're phenomenal. The training that they bring, the motivation, if you think about the motivation it takes to move all the way around the world and set up a new life in order to have a new career in your chosen profession, just phenomenal motivation and resilience, and they're really impressive people. We also celebrated 10 years of apprenticeships, having supported over 700 people to start their NHS careers. Nothing actually gives me greater joy than to see young people at the start of their careers and all the amazing things that they bring, the energy that they bring and the ideas that they bring, and to be able to support those to become qualified professionals in their chosen field is just a wonderful thing to be involved with. Also around learning disability, we've supported the first Masters in Learning Disability Nursing through something called the Aspire programme. There's a national shortage of learning disability nurses, and we're going to need in particular quite a lot as we move forwards, because we're opening some new facilities in the next few years and wanting to improve services in particular areas. And we can't do that without learning disability nurses. So it's just fantastic that we've been able to do that. Our Great Place to Work initiative, which is, if you like, an organisational development programme, at the moment largely focused on leadership, but leadership by we use a phrase in the NHS, distributed leadership. You know, yes, I am the accountable officer of the organisation, but it's not like I pull a lever and the right outcome appears magically out of the machine. There are dozens, if not hundreds, of people involved in making those things happen, and skilling those people up, tooling them up to do their jobs really, really well, and supporting them to grow and develop and have good feedback loops and be accountable for their actions. Hugely important. That's touched over 1,000 people so far in the organisation, and over time will touch all people in the organisation. And just to give a flavour of that, I was in a session last week with some of our Great Place to Work, I think they're called champions, I might have the nomenclature slightly wrong, and they were reviewing all of the feedback from all of the sessions, and it just blew my mind, the quantity and quality of feedback from colleagues about what they think a great place to work is and what we need to do about that. Just a really rich scene to explore and see what improvements we can make, so I'm very grateful to the people doing that. And staff survey is a key litmus test for me. And the thing I'm proudest of, and it didn't quite make it into the slides, but I'll talk about it. For me, the two acid tests in any trust's staff survey are the percentage of staff who would recommend the trust as a place to work, and the percentage of staff who would recommend it as a place for their family, and friends to be treated. And if you look at long-term time series of those over 10 years, or particularly over the last 3 to 5 years, those are both moving significantly in the right direction. And over the last year, just about every measure of our staff survey moved in the right direction, which means that we are, really moving the dial slowly on these things. But of course, there remains much work to do. Next slide, please. In terms of outstanding care, there are so many things I could talk about, which doesn't, by the way, mean that everything's perfect all of the time. We know it isn't, and we tend to focus our time and energy on areas that aren't, but it is worth just stopping to reflect, celebrate, and share some things that have gone really, really well. And here are a few examples. There are many more we could give. Out of area placements, if you imagine yourself in a mental health crisis, potentially sectioned under the Mental Health Act, moved to an inpatient facility, needing immediate treatment to help stabilise you and support you, and then being placed back in the community with some support as well, or a family member or carer for that person. To have to do that in a strange facility a long way from home, where maybe family and friends and carers can't easily access you, it's just a terrible experience. It kind of compounds the acuity of that experience. So we've really focused on reducing that, and on average in the last financial year we placed only 4 patients out of area at any given time, compared to 11 the year before and 33 the year before that. And that also has a significant financial impact, because we're not funded to do that. We do it in extremis when we feel that we have to and there's no other option, but then that creates a financial deficit. So there's a twin benefit there of better quality in patient experience and better finances as well. And that is down largely, but not exclusively, to the efforts of Matthew Page, our Chief Operating Officer, working with and through many, many colleagues, and they deserve enormous commendations for that. And going into this financial year, which of course we will talk about later, we've certainly bucked a national trend there. So whilst we've been struggling to keep them out of area placements at the same level as last year, when you look at us compared to comparator trusts, we're doing much, much better than most others. And many, many people have come to talk to us to learn from our experience and copy some of the elements of what we've been doing. Access to perinatal services. If anyone knows anything about perinatal mental health, particularly postpartum psychosis and or depression, the really tricky ones, the mortality rate for people suffering from postpartum psychosis and depression through suicidality has been very, very high historically, and there's a national initiative to do much better there. And I'm really pleased that we're doing extremely well. We've further expanded our offer and are now achieving the target that's been set nationally. Another one to note would be 72-hour follow-up to inpatient discharge. Given the story I was telling about what it feels like to be sectioned and admitted to a ward, crucial first few days when you go back to your original place of residence, or more likely a new place of residence, and making sure that mental health services are following up and helping keep you safe and get settled in your surroundings, hugely, hugely important. And we're able to do that for more than 80% of patients currently. And waiting times, as you can see here, I shan't go through the detail. but some really creditable achievements on waiting times, particularly given the context of kind of post-COVID and financial austerity. Real commendations to everybody working in those services for managing to meet demand when it appears. So thank you, well done to everyone working in those services. Next slide, please. In terms of sustainability, as well as reducing out-of-area placements, which I've talked about, we have reduced agency spend significantly, and the metric given here is £400,000 reduction in February 24 compared with 23, and that trend has continued. Again, a huge amount of hard work by both Matthew Page, but also Sarah Jones and colleagues, who's our nursing director, and many other colleagues to make that happen without compromising quality of care. And that's the acid test, is, are we doing it without compromising quality of care? And we check that all of the time. So we have check and challenge sessions regularly to make sure that we're not negatively impacting quality by doing that. And healthcare support agency annual spend has decreased by a third. And again, that trend has continued into this financial year, which bodes well for the future. We've also approved a £20 million business case for a new learning disability and autism unit, which I mentioned briefly earlier. Hugely important because our region doesn't have one. There's going to be one in the north of the southwest, which is us, and one in the south of the southwest, which is Devon. And that's designed to support quite a broad catchment, as I'm sure you can imagine. And then what we also need to do is to ensure that the services surrounding that inpatient unit are equally ready to support patients, because most of the care that we provide is actually outside hospital, inside. So there's a big programme of work and change involved there, principally led by my deputy Alison Smith, who's doing a fantastic job on that. We've also, we're in the process of redeveloping our main campus in Bristol, Callington Road. It's slightly halted at the moment due to some complex legal matters that we're in the process of resolving. But crucially, that will allow us to move our place of safety, or 136 suite, off the North Bristol site and into Callington Road, and one of our wards off the North Bristol site, North Bristol Trust site, and into Callington Road, which is something we've wanted to do for 6 or 7 years. So that's great as well. We delivered a break-even revenue financial position with some support from the system, for which we're very grateful, and have continued our reduction of carbon emissions through our Refresh Green plan. There's a whole plan around carbon reduction, which is really interesting to read and talk to colleagues about. So if people are particularly interested in that, we could do some sessions on that perhaps separately. So sustainability, absolutely key to everything that we're doing as well. Next slide, please. And finally, working together in partnership. You're going to hear a little bit later about our working together strategy, which is how we work with patient service users, family, friends and carers to make sure that we design and deliver services that meet their needs. Speaking as somebody who is a carer for somebody with very complex physical and mental health issues, I absolutely know how difficult it is. So anything and everything that we can do to make that better is hugely important. If you look at what the Carers Trust say, most of the care for the people that we support is actually provided by carers, not by us. So not supporting them well and not understanding their perspective and not making sure that that's embedded in everything we do would be a major misstep. We're also really proud of our new approach to something called CPA, or care planning. So CPA, which has been around for almost 30 years, is the main tool used by mental health services across the country for prescribing and delivering care for people with serious mental illness. And most practitioners will say, yeah, it's kind of, it's served its term, it's sort of not really fit for the future. And all trusts were asked to consider a better and different approach to that. Our approach has been widely co-produced, is very person-centred, and we think class-leading. And we think when implemented across the entire trust, which will take the best part of 2 years, will be a fundamental game changer in the way that we deliver services. And then linked to that is our approach to safety planning, used to be called risk assessment, is how you support people to keep themselves safe. and I think those two together with something else that's not described here called PSERF, which is a new approach to reviewing when things don't go so well. I actually think that those are fundamental seismic changes in the delivery of mental health services that will substantially and substantively improve the quality of care that we provide. So I'm genuinely really excited about those things. Also worth mentioning our work with local police to support people in mental health crisis, sometimes called the Right Care, Right Person programme. It's been quite controversial nationally. Our colleagues, and again, I would single out Matthew Page, but he would be the first to say it's people like Matt Truscott and others who've done the actual work. Really phenomenal. And in fact, we had a letter of commendation from local police chief just a week or so ago, thanking us and commending us for our outstanding work in this area. And it's not just about the police, the ambulance service, I think, would say a very similar thing. Somebody presenting in a crisis does not necessarily need to be blue lighted to a prison cell, a 136 suite, or a hospital, an acute hospital. There's lots of other ways of supporting them better, and we're trying to be at the forefront of that. And finally, part of our green social prescribing pilot, which was in the national news earlier this week or last week, really big pilot that we had a leading role in and are both at the forefront of, but also the emerging evidence from that is really interesting about how you can use alternative methods to help people recover from mental health illness or crisis in mental health illness and become well and get rehabilitation. And enormous credit to everyone involved in that. Also worth saying, it's very cheap relative to the outcome. So as we're thinking about how trusts across the country can deliver more care with tight budgets, things like this may well be some of the things that we can and need to do much more of, and I mean much more of, because they don't take much investment, but they have a massive impact on the patient's journey. So that's just some examples. We could talk about more, and I would love to, but I know that Brian would be looking at his watch saying, come on, you need to get a move on, so I won't. I think that's largely me done. Is there one more slide? Some challenges. Yes, I wouldn't be a good chief executive if I didn't point out some of the challenges as well. So performance, some of our performance metrics are slightly off, but we are pretty confident that by the end of this financial year, they will all be back on track. I say pretty confident rather than very confident, because often there are things that one can't legislate for, but we have good plans and good trajectories, and we're monitoring those carefully. So we'll see where we are in 6 or 9 months' time. I would like to mention the Riverside Adolescent Unit, for which we took the very difficult decision to enact a temporary closure for patient safety reasons in January following some serious incidents. That will be reopening. We're just currently looking at the dates of reopening and the plan for reopening. It's currently subject to a peer review and external assessment to sense check for us whether it's ready and what we would need to do to keep it safe. Those kind of decisions, as I'm sure you can imagine, are very, very difficult decisions to make, but we always have to put patient safety at the front of our mind. And if we can't be assured that we can keep patients safe overnight, as it were, then that's the only choice that we have, really. And I'm very grateful to neighbouring trusts who've supported us and patients in those services, but also to the staff working in community children's and adolescents mental health services, who've held a lot more patients held in the community. Sorry, that's NHSP, who've supported a lot more patients in the community, thereby avoiding admissions. Froomside, which is our secure unit, was subject to a range of quite significant, very significant whistleblowing concerns around standards and behaviour about a year ago. And we had to suspend a very large number of staff whilst those allegations were investigated. And action was taken against some staff. Others, we found that there wasn't enough evidence to support allegations made, and therefore that wasn't the appropriate thing to do. Following that, it was rated as requiring improvement following CQC inspection in January, which is the same rating it had previously. But clearly it remains very much on our watch list. I was there a week ago talking to the leaders of the service. And I think they've got a really good formulation, but it's very hard work and quite a difficult challenge. So we just need to recognise that that's the case. And then following that inspection, we had a letter of concern from CQC regarding culture and standards that we think we responded to well. We met with CQC and talked it all through, and I think we have a kind of shared view on most of what they were saying. And frankly, most of what they were saying were things we told them, which is good because that means that we're relatively self-aware about issues of concern. And during the period, we continued to respond to the 29A notice that was served in January 2023. That notice has now been discharged following a subsequent inspection, but that didn't happen in this financial year, so we're not kind of formally noting that here and now, but I'm really pleased that that has been now withdrawn, or whatever the right language is around that. Thank you. Next slide, please. And finally, just to say a huge thank you to all our staff. I travel around the trust as much as I can and nowhere near as much as I would like. And everywhere I go, I meet amazing people doing amazing things. And it's a cliche to say it's humbling for an NHS leader, but it truly is humbling as an NHS leader. We have amazing people and they do amazing things. And that's what keeps the NHS going. That's what keeps us going. Every year we run our staff awards, and it's my proudest moment of the year to go to that and just listen to the stories of some of the things that people have done. And then once a year, in fact, it's happening next month, we have our what we call our positive practice celebration event, when colleagues just come and share some of the work that they've been doing, very largely their own volition, to improve things for service users and staff. And it's just amazing. So thank you, thank you, thank you. You're all amazing. I know just how hard you work, and we really do appreciate it. Thank you.
Thank you very much, Dominic. And I think it's absolutely great to showcase some of the fantastic work of our staff across the trust in conjunction with patients and carers, and also right to balance it with some of the ongoing challenges. So Dominic, thank you very much for that strategic overview of the work that we've been able to undertake through 23 and 24. I'll now hand over to our Deputy Director of Finance, Pete.
Thank you, Brian. Good morning to everybody. I'm going to give you a bit of a whistle-stop tour through the financial performance of the Trust during 23-24, and also just talk about some of the successes and challenges that we've got ahead. So in terms of the key headlines associated with financial performance in 23-24, from the slide that's up on the screen at the moment, you can see that we delivered a break-even revenue position in year, which was in line with our plan, but is a real success story given the financial challenges that have been being experienced across the NHS during the period. We also delivered against our capital resource limit while delivering against national funded projects as well. And obviously, capital is the money that we spend on developing our infrastructure and building. So it's really important that we deliver against those programs of works to make sure that we make as many improvements as we can. We exceeded our cash limit target for the year, which basically means that we ended up with more cash in the bank at the end of the year, which is a good sign in terms of overall financial performance. But as a sort of indicator of how things are, we also were able to maintain an excellent performance against the Better Payment Practice Code, which is the national measure of how quickly we pay our small suppliers and whether we pay them on time. From a national perspective, we continue to be one of the best performing trusts in the country against this metric, and have previously had some commendation from the Chief Finance Officer of the NHS on that metric, which is a really positive indicator of the sort of financial performance within the organisation. We also maintain strong financial governance practices despite continuing operational pressures. During the period, we had both an internal audit review of our financial controls and also independent assessment from an independent system appointed representative of our control environment, which came back as very positive. So from a financial control perspective, really good within the organisation. Next slide, please. From an audit perspective for 23-24, we received an unqualified opinion following an audit of our 23-24 accounts. That's really positive. That means our financial records and statements are fairly and appropriately presented, and their auditors, Grant Thornton, have reviewed our approach to year end in detail and are comfortable around the approach that we take to closing down the financial position. So that's a good indicator, again, of financial control within the organisation. The value for money opinion that continues to be a core part of this audit process continues to be qualified, however, but that is due to the fact that we continue to have an underlying financial deficit within the organisation, are linked to our CQC rating of requires improvement, and also the current status of the Trust clinical governance framework. So we do have an action plan that is pulled together as part of that audit process, which has improvement actions that we would intend to take forward during 24-25 to address some of those concerns. Next slide, please. Just to give you a bit of a flavour in terms of some of the detail that sits below the break-even financial position. So we spent £286 million in year on staffing costs, and within that, agency staff costs represented 37 million against a plan of 27 million. So we spent 13% of our total staffing budget on agency staff. That was marginally less, as I think Dominic reflected in his slide, than we spent in the previous financial year, but still significantly more than we had planned. What we have started to see, and I'll come on to shortly, is a significant reduction in agency spend as we move forward into 24-25, which is really positive and will help to support the sustainability and underlying position of the Trust moving into future years. In terms of our efficiency programme, we delivered 4.3 million of efficiencies in year, which had a full year impact of 6.6 million. And that represented 60% delivery against our original plan of 11 million. So we delivered more than 50%, but obviously not as much as we would have hoped to have delivered. And that has left us with some additional efficiency challenge that we're having to deliver in 24-25. As previously noted, we delivered a break-even position, which was in line with plan. And also we retained a rating of 3 against the single oversight framework that we are judged against from a NHS England perspective. Our rating of 3 is due to the fact that we have an underlying financial deficit, and also we have a significant reliance on temporary staffing to support services. So again, we've been through a process there where we have improvement actions that we are looking to put in place in 24-25 associated with the single oversight framework. Next slide, please. The key challenges that we have in terms of we saw in terms of the financial position in 23-24 were obviously linked to the use of high-cost agency to maintain staffing levels. Agency comes at a significant premium, hence the significant focus that we have seen over the year and also moving into 24-25 to reduce the level that we spend on agency staff, both from a sustainability perspective, but also because we want to have filled our posts with substantive staff and to have a core team of people working to support services and patients. We received non-recurring system funding of 12 million. That was part of the annual plan from our core commissioner, BNSSG ICB. So although we delivered a break-even position in year, we still have an underlying deficit on a recurrent basis that we will need to address in future years. And we have a medium-term financial plan that works to address our underlying deficit in future years as part of our financial strategy. There are significant costs associated with investing in our estate in order to improve service user and staff safety and bring them up to as high a quality as we possibly can. Some of that we are managing through the award of national funding to develop to support programmes of work, but there will always be some areas where we have to prioritise what we spend our money on in order to be able to live within our financial means. And although we have made some progress on out of area placement numbers, as Dominic mentioned, we continue to have some significant spend in that area. And so as part of our plans for 24-25, we look to continue to reduce the number of people who are placed out of area and the money that we spend on them as part of moving towards a zero out of area position. Next slide, please. So in terms of what we spent our capital funding on in 23-24, so we spent 16.5 million on capital investment during the year. A significant chunk of that, so 9.6 million, came from what we call public dividend capital, so investment from the Department of Health and Social Care into capital schemes. We use that funding to progress the development works at Callington Road, to develop a new male crisis house in BNSSG, prepare for the works that have commenced now on our new learning disability and autism unit in Bristol, and also to support the development of our digital infrastructure. So some really key investments there. We also spent 8.5 million improving the safety of our environments. These works range from improving environments for anti-ligature, fire safety improvements, through to changes to inpatient ward layout and design to improve safety. And in addition, there was 4.1 million partly funded from the public dividend capital that was spent on improving our digital infrastructure. So some real good investment in our future to try and ensure that we are fit for purpose and that we have safe and sound environment and infrastructure. Next slide, please. In terms of the financial outlook for the trust heading into 24-25, so we continue to focus on achieving and delivering financial sustainability over the next 3 years. And as I previously mentioned, we have a medium-term financial plan which plans to deliver an improvement in our underlying deficit over this period, and that's in line with the agreed system plan that we have in BNSSG. To support the delivery of that improvement, we have improved our workforce position in the first quarter of the year, reducing reliance on agency staff significantly, with monthly spend reducing from 3.2 million a month down to 1.8 million a month. So that is a really marked improvement over the spend levels we were seeing in previous months. And that's been backed by additional substantive recruitment into posts. So it is about making sure that we've got staff in the right place to support patients. We continue to focus on reducing the reliance on non-trust inpatient beds, so reducing out of areas and supporting more people in the community. So that's really positive. We are focusing on improving the efficiency of our service provision by looking at making productivity improvements, so to try and minimise the time that staff are taken away from their primary duties of looking after patients. And so that's another thing that we've got. And also we have a recurrent savings target of 9.7 million in this financial year 24-25, which is progressing well year to date. And that's mainly due to the significant delivery that we've made as part of our agency reduction programme. Next slide, please. So the risks in terms of our financial sustainability moving forward, there continue to be challenges with supply of staff. We've made some significant steps forward in terms of improving substantive fill and reducing agency usage, but there are fewer staff entering into training programs, and we will need to try and maximise the use of new and alternative roles to be able to mean that we're sustainable moving into the future. The demand for mental health services continues to grow, and that puts pressure on services and staffing levels. The state and design of many of our buildings restrict the ability to transform service provision into the future. So that's linked to the point around the need for investment to be able to develop flexible and new ways of working within those environments. There's currently a lack of identified funding to support full-scale digital transformation. So obviously that will impact on our ability in the future to be as productive as we possibly can through our use of digital. There's minimal additional funding identified at the moment to support the improvements that we're trying to make in terms of the trust culture. So there isn't lots of new money floating around in terms of investment. The financial outlook for the future of the NHS is really challenged at the moment. So we obviously have to balance. And that's it from me. That was a summary of the key headlines relating to the financial performance of the trust and the outlook heading into 24-25. Back to you, Brian.
Thank you very much. Thank you very much, Pete. I'm going to hand swiftly over to Sue, who's our patient and carer experience coordinator. So, Sue, over to you.
Good morning. Hello, everyone. My name's Sue Woodland and I work in the Patient and Carer Experience team. So for those of you that don't know that, it's a very small team of about 4 individuals who work trust-wide across all our areas and link in with our local involvement coordinators. We have about 10 across the trust. The involvement coordinators, for those that don't understand the term involvement, it is people with lived experience that are involved with our services. So our involvement coordinators will link in with service users, carers, community and voluntary organisations and bring their voices to all the work that we do. So the patient experience team gets and gathers all the voices from across the trust to improve the work and services that we do within the trust and make sure that they are heard. The vision of our services is to make people that we work with, the people with lived experience, to make sure that we listen, collaborate with them, their friends, families, service users, to understand what they value and make sure their experience helps to make services better. So by doing that, our goal is we're going to work in partnership with carers, the public, putting co-production at the heart of everything we do to bring in diversity of voice and thought. For those that don't understand the term co-production, it will be explained further by my colleague Chris, who will be explaining the working together strategy and how we got there. So co-production is working jointly with service users and carers and bringing that voice into the work that we do to drive changes that matter to patients, carers and the public, and to find ways to increase the profile of underrepresented communities. So with that in mind, one of the big pieces of work that we have been doing over the past couple of years is the Working Together strategy that was co-produced with service users, carers, getting the voices from some of our communities and bringing that into a one-page document. So I will be handing over to a video of our Chris, who unfortunately isn't able to join us today because it is actually shows that we are working in co-production, because currently he is working with service users and staff to present some training today. So here's a video of our Chris.
Hello, my name's Chris. I'm a former service user and I'm here today to talk to you about Working Together, our lived experience, involvement and co-production strategy for 2023 to 2025. This is a fully co-produced strategy that took 18 months to develop and was worked in co-production between service users, carers and members of AWP staff. We formed a lived experience, involvement and co-production strategy group to review the existing strategy and to develop a new strategy. The strategy group included people with lived experience from different localities, as well as within our specialised and secure services, as well as AWP staff. The strategy group wrote a plan for workshops to run in localities and within services to listen to the views of patients, service users and carers. The strategy group created questions to ask people with lived experience about what worked well in involvement and what could be improved. Workshops were run in different locations to gather feedback from service users and carers across the board. People told us about their experiences with involvement and what they would like to see more of. We took notes of all the feedback from the workshops that were held. The strategy group took all the feedback from the workshops and then discussed whether there were key themes where feedback was similar and could be grouped together. We also kept all the feedback from workshops to help AWP learn from experiences and use for further improvements. Grouping the feedback together, we found similar themes. We were able to then make a map of all the main themes and ensure that all feedback had somewhere to sit within our strategy. We identified the shared vision for what involvement and co-production should look like, an overall purpose for what the strategy was meant to achieve, and 4 key aims. From service user and care feedback, we wanted our strategy to be easy to understand and to be able to display clearly on a page. So our final design, we had a vision, working together to ensure that people feel valued, supported and heard to participate meaningfully in equal partnership to design, develop and deliver services, build and strengthen communities in order to bring about positive change. Our purpose for the strategy was to demonstrate improvement of our engagement with patients, service users and carers by providing opportunities for meaningful involvement in co-production activities throughout AWP. And we had 4 key aims: working together for all, working together in partnership, working together in providing opportunities, and working together in co-production. Working together for all is all about improving diverse representation and involvement in co-production by offering opportunities that embraces a person-centered approach and reflects the people who use our services. Working together in partnership, we would actively recognise and promote involvement in co-production with people with lived experience. Doing this within AWP, in local communities, with our partners in wider mental health, autism and learning disability communities. We'd work together in providing opportunities. Together we will improve the quality of involvement in co-production by ensuring that people with lived experience are offered meaningful opportunities to work with AWP and are appropriately supported or taken part. And working together in co-production, we'll work with people with lived experience to develop and apply best practices to our service design and improvement projects, and to ensure we work to increasing standards of involvement in co-production. We took these aims, the visions and the purpose back out again to service users and carers for feedback on the draft strategy, and we asked if the vision, purpose and aims of the strategy were shared by the involvees. Was it what mattered to them? The Working Together strategy was then presented and ratified at the Caring Domain subgroup in May of 2023, and the Working Together strategy was then presented to the Trust Board in June of 2023 and ratified in September. We then set up a new delivery plan group to revitalise our efforts and to actually launch the strategy and put it into practice. This group included members from the original strategy group and new service user and carer members. The delivery plan group was formed to look at what areas of work were needed for ensuring the Working Together strategy would be successful and what were the most important things to do first. We held sessions using the appreciative inquiry method to make sure everyone felt able to participate and be heard, and to work on the positives. The delivery plan group identified a large number of options for individual actions that AWP could take to improve involvement in co-production, based on feedback from service users and carers. To understand what would have the most positive impact and was considered the highest priority to get right, we developed a survey asking people to use star ratings to show us how important an area of work was. We gathered feedback using online surveys and through face-to-face groups and forums so that everybody had a voice. We were able to identify the top 5 priorities for service users, for carers and for staff, as well as an overall top 5. We used the top 5 highest scoring proposals and the top scoring proposals in each group to identify the key areas of work. This gave us a top 10. By using each group's top 5, we did not need to weigh scores differently, but could still identify individual areas that would have the most impact in each group and those that were shared. Having identified the key priorities and work for delivering the Working Together strategy, we started looking for service users, carers and staff who were interested in working in co-production on these actions. We recognised the need for 3 key work streams: creative and editorial working group, the training and support working group, and the standards data and monitoring working group. These groups will also report every 2 months to the joint strategic group of service users and carers for oversight. And so at the moment, we have these 3 work streams in place: creative and editorial, who are working with AWP communications team to promote the strategy, with plans for open mind sessions, updating our space, and creating an external landing site on the internet to share information, showcase trust-wide co-production work, and signpost to community organisations. And the group are also co-producing a newsletter to represent service user and carer experience. The training and support work stream have initial work to establish a tiered training packages for involvees, as well as an involvee passport to support accessibility needs in its initial stages of co-production. And the standards data and feedback group are looking to establish current data on involvee participation and create a questionnaire to target staff and involvees to study the impact of involvement on all groups, to collect EDI data and activity analysis, a working together dashboard for involvement. You can find further information about the working together strategy in different mediums to tell you more about our ambitions, whether via the video, a BSL British Sign Language video, or an easy read leaflet. Staff can keep up to date with the working together strategy on our space, and if you want to get involved, please do contact the patient experience team with any comments or queries.
Hi, so that was Chris, who put it so much better than I ever could. The working together strategy. The newsletter is out there now and it is being delivered across the trust. Not only is it on our external web pages, but physical copies are being ferried across the trust today to arrive in different waiting areas to go on the wards. So it's all there for people to see about the hard work that has been going on and the co-production that has been worked within our services. That as well as the carer event as well, I'd like to highlight that. This is an event for our carers that's going to happen in a couple of weeks' time. All these priorities here that were fed to us by service users, carers and staff, we are as a team working in co-production to make sure that we get these things done. So that is talking about our priorities. Chris has explained how we're doing them and the working together strategy and our ongoing work. But I do realise now that I have to hand over to our colleague. She is Claire. She's an expert by experience who will share her experiences working on the Your Team, Your Conversation and Your Plan project. So over to Claire.
Thank you, Sue. So yeah, as Sue said, my name is Claire Smith. I'm an expert by experience working within AWP. I do lots of different things within AWP, and Dominic has already alluded to the care planning approach, which we are updating. Just to say that this is a massive, massive project. Okay, so it's not something that we have taken lightly. Service users, carers, AWP across the board. It hasn't been changed for at least 2 decades, and this is a massive change. So your team, your conversational plan is what I'm going to talk to you about today. So my slides are going to be about the principles and the quality pillars. I'll just give you a quick overview. I'm going to then talk a little bit about the model. I'm going to talk more about the co-production and co-design that's gone into this, so how everyone has contributed, some examples of some of the groups that have contributed that have been put together, and then my experience, my personal experience of working alongside AWP and alongside those groups, and what I've got out of it and what I think all the teams have got out of it. So next slide, please. Yes, thank you. So as you can see, there's 6 principles. So the co-production, collaboration, human rights and equalities, positive and transparent work with risk, proportionate and flexibility, and trauma-informed. So co-production and collaboration, you would think are obvious things. So we're working together to produce a service and that is around the person. So we want the person at the very centre, whether with carers, other services, so VCSE, so voluntary sector organisations that will come in and help that person on their recovery journey, and for everyone to work collaboratively. We want them to work all across professional boundaries. We're not working in silos anymore. We're going to all work together and it's going to be happy days, is my vision for the future. Obviously, we're advocates for human rights and equalities. Everyone needs to be able to get the service they need at the right time. Positive and transparent work with risk. Again, Dominic alluded to the safety planning that's going to change. We want it to be supportive, sensitive conversations. That needs to change as well. Also needs to be transparent for the service user. Proportionate and flexible. We need our care plans or our personal wellbeing plan, which we'll come on to later. They need to change as we change. So as we evolve and we become more accountable and our care needs to change and our carers, our social networks change, so does our care and so does our plan. Trauma informed. We all, to an extent, have different levels of trauma and we need to be treated sensitively and empathically towards those. Quality pillars. these are absolutely essential. So relationships, we need to build trust in relationships across the board, again, with every service, with every interaction we have, staff as well as service users and carers. They need to be positive, and we need to be able to build on those. Without those positive, trusting relationships, you're not going to get the engagement and interaction that is going to aid that recovery journey. Reflection, again, this is a two-way thing. So I need to be able to reflect on how I was when I was unwell, what worked, what didn't, but also staff need to be able to reflect on what they thought worked and what didn't work. How is my practice? Is this good? Is this bad? What can I change? What went really well? Communication, open, clear and transparent. Say it as it is. We need to document it, and then we need to move on. Next slide, please, Jess.
Claire, can I just very briefly interrupt, just to apologise for people for my awful chairing. We're already beyond 11 o'clock.
Yeah.
Apologies to those that have to leave, but I'd really like Claire to go through the rest of the presentation. So for those of you that can, please bear with us. Those of you that can't, the presentation will be recorded. Please accept my apologies. And if anyone has to leave, wants to send in questions to me, I will ensure they are answered. But I'd like to see the rest of Claire's presentation, if you don't mind. Back to you, Claire. Thank you.
Thank you, Brian. That's fine. So the model is essential as well. So we've got the team, the conversation, and the plan. So the team is, as it says on the tin, so the person is in the center, and then we're looking at the key person. So the key person's in the middle, and then you've got all the other people around the outside. So you've got the social network, is that carers, young carers, social friends, professionals around that person, other agencies that are involved with that person at that time. So they all need to be interlinked, they all need to be communicating. Then you've got the conversation. So the support conversation is one of the biggest things. So everyone's a little bit, kind of worried about the support conversation, if we're honest, but it's what everyone's already doing. We're just labeling it as a support conversation. So on the wards, people will talk to people about their risk, they'll talk to people about how you're feeling today. These are support conversations. We're just labeling it as a support conversation. So the things that people are already doing, like I said, we're just labeling that. So it's working collaboratively with someone to achieve the best outcome for them with the resources they have and the strengths they have to move them forward. And then all of that gets documented into a personal wellbeing plan, which is an accessible document for everyone. It belongs to the person, so it's the person's plan, obviously, that's why it's a personal wellbeing plan, and then they are able to access that, and it can be updated and edited as we go along. So it's co-produced, it's mine essentially. Then the implementation update that we've got is obviously we've implemented in South Gloss and Mint. We are now currently, the reason Chris isn't here and the reason I won't be here this afternoon is because we are in North Somerset, in Weston actually. There's very nice weather, I have to say. Doing some training in Weston. That'll carry on to December, and then we're implementing BSW January 25 to March 25, and then we're going to go into Secure from April 25. Next slide, please, Jess. I'm rattling through. Thank you. So this is the bit we like: co-production and co-design. So I'm going to start with reading a little bit from Phil Wiltshire. If anyone doesn't know who he is, social worker, but he's also the delivery lead for this project. So I'm going to read it out because it's definitely more prominent that way. So the Beyond CPA, which is what the project was originally called, was transformed by the input of more than 50 people with lived experience. It is impossible to count the number of times that the clarity of the perspective of someone who has actually used services cut through the discussion and enabled everyone to see beyond their well-trodden usual thought patterns and to start to grasp what was most important. Similarly, the training program would be less able to grip staff's imagination without the lived experience that grounds it in reality. The project team are hugely grateful for the help that has been received. When I was at training in Weston on Tuesday, it is very, very clear by having people speak from experience in front of staff face to face, it makes a massive impact. We can look at videos, we can recount someone else's experience, but actually having the experience face to face is definitely more impactful from what I read the room while I was sat there watching people. Staff have also said that it's made an overwhelming difference actually, and there's a few quotes. So having a person with lived experience has been invaluable. We did some role play at the end. So Justin Keeble and then one of the we've just picked someone out the crowd, I think, to come and do a support conversation role play, and that brings it into reality. So it seems quite abstract when you're sat there, you know, kind of, oh, we're going to do support conversation and this is what it might look like. Actually doing it like in person in front of people, it gives people an idea of what it might look like in practice, and I think that helps. On the bottom right of your screen, these are some documents that have been co-produced. So we've co-produced overview booklet, which will be available. The consent to share, which is the service user 12-page version, will be available within the trust. And there's a consent to share carers, friends and family version. We felt it was important to have two separate versions. Really important that the carers, friendly and family have their own version, because they are slightly different, the rules and regulations around sharing. And I think it's really important that they understand that they have rights. They are entitled to certain aspects of information and not others. And it's important that they get that in, you know, kind of plain English and they can understand it. Next slide, please. Thank you. So this was basically a snapshot of some of the groups that have been involved to date. So I've been working on this project for 18 months, and in the last 18 months, these are the groups that have been involved. So you can see that there's some task and finish groups, booklet designs, there's kind of locality workshops that have been involved, and these are groups that have gone on for months or weeks at a time, and they've all had lived experience, carers, joint groups or separate groups. Next slide, please. Oh, they didn't find that on the web. Next slide, please. So this is my experience. So like I said, I've been working in this project area about 18 months, probably over 2 years. I found it empowering and quite insightful, actually. I think when I started, I thought that our voices weren't really that well heard, to be fair. And it's given us amplification, I think, within the trust. People feel more heard now. And we're definitely, within this project, we're definitely the core voice for this project. It's shown power and impact of our narrative. So when we give our talks, when we talk within the training sessions, you can see how powerful the narrative is and how it hits hard, basically. Collectively, I think we've learned, and I think that the staff are learning, and we are learning as we roll through each area, because each locality is different, each region is different. You've got different population, you've got different staffing, and everyone is different. So we're learning as we go through this project. Some people say tokenism is a thing when it comes to involvement. I've never really brought into it, and I don't think this is anywhere near tokenism. I don't think it's I don't think AWP as an organisation is doing this to tick a box. I don't feel that way about it. I think this is change from the top down and from the bottom up, and I've said that all along. It's important that that's the way it is, and I think that's how it's happening. There is co-production, there is collaboration, and that's been from the spark of the formulation right the way through the design and the delivery of the training and all the way in between. If things don't seem right, and if there doesn't seem like there's enough input, then it goes back to the drawing board and we come back again and kind of try again. But the most important message to take away from this is, as service users, we are in charge of our own destinies, and we deserve a service that is adaptive, trustworthy, trauma-informed, me-focused. And through co-production and collaborative working, we have produced exactly that alongside AWP. Thank you.
No, thank you, Claire. That's been absolutely fantastic. Thank you very much for sharing, and also thank you to Sue for putting all that section together, and for Chris in putting together the video. As I say, apologies for being an absolutely awful chair. That means I will have to now pull the meeting to a close. For those of you that wanted to ask questions, I see a few have popped up in the chat box. Thank you for that. You, of course, have the opportunity to use that email address there, awp.askthechair@nhs.net. I'll personally make sure that all of the questions that come in have replies. Of course, you can send in questions at any time, and you are welcome to attend our board meetings in public, of which the dates are on the website, and the next one will be on November the 6th. Just remains for me to thank all of our board members for their hard work during the year. Thanks again, echoing Dominic's thanks to our fantastic staff. All of this work is down to them, and we really do have an absolutely fantastic bunch. I know many of them are with us today, so thank you so much for everything that you do, and thanks to all of you attendees. Thank you for everyone who joined us this morning. I will now formally close the meeting and say thank you, goodbye, and enjoy the rest of your day. Thank you all.